and welcome to Not Your Mother's Midlife Crisis. I'm Chris. This is my fabulous co-host, Chris.
Hello, Chris. How are you doing?
I am happy to be here with you.
Yes,
And
same.
yes,
You're the highlight of my week. Yes.
it's fun time. Always a good time.
And another highlight is this episode where we have Dr. Maura Pluchino with us today. And we are very excited because Dr. Pluchino is the founder and owner of Practically Perfect Physical Therapy. I have to say that three times fast in Galloway, New Jersey. And she has been a PT specializing in pelvic floor since 2016. So thank you very much, because I feel like I think of my pelvic floor every day. She has completed over 2,000 hours of direct patient care in this specialty, but loves carrying a diverse caseload. And these days, she primarily sees patients for the pelvic floor and teaches for the Herman and Wallace Pelvic Rehabilitation Institute. So welcome.
Thank you.
Welcome, Mora. We are so excited to have you. I was fortunate enough to get to meet you when you did a seminar at Olakai Gym in Brigantine. And I went in thinking like, I know a lot about my pelvic floor. I didn't know anything about my pelvic floor. I thought I knew it all because yes, I thought it was all just Kegels. And that men have pelvic floor. I really learned a lot, and I'm so excited for our listeners to benefit from your knowledge. So this is really a great opportunity for all of us and our listeners. So thank you so much for your time.
I'm so excited to be here. This was on my bucket list for this year to be on a podcast. And I was like, oh my gosh, you guys reached out to me? Thank you.
Yes. This is just your first one. There, there'll be more. There'll be more.
That's awesome. And as we've talked in other episodes, I did go through pelvic floor PT about 4 years ago. And again, I was still shocked that I'm like, here I am, 52, 53 years old. And this is the first time I'm learning all about this, which is just a small portion because I know that there's so much more to learn. So I am really excited to kind of get started and ask you some questions. So
let's do it.
Yeah. So really, what exactly is pelvic floor PT and who should consider getting this type of therapy?
PT is a specialization of physical therapy or occupational therapy, actually. So you can have a pelvic floor provider who's a physical therapist or an occupational therapist, or a physical therapy assistant or an occupational therapy assistant. Those are the most common people who provide that service. And they are people who've done additional training on top of their profession. So I had to go to PT school. I graduated in 2009, and I was a PT first, and then I take continuing education to get this specialty. Anybody who's like a physical therapist, occupational therapist, nurse, doctor has to do continuing learning to keep their license. And so that's where a provider would do that to get that extra information specific to the pelvic floor. So I always say we're experts at the abdominal canister. So your pelvic floor is like the basement of your body. And then you have your diaphragm in your rib cage. And then you have like your belly in your back. And they all work together like a bottle of water. And so we are a therapist that works on all of those things. And then your back goes into that and your neck goes into that and your hips go into that. So we're just people who have done extra work to really figure out that biomechanical piece and put it all together for you.
That's great.
That is really.
Mm-hmm.
And then you asked who should do pelvic floor therapy or who could benefit? Yeah. Everybody. And I always get a little spicy when they're like, oh, it's women's health. And I'm like, heck no, it's not just women's health, right? Because we have there's so much gender diversity, right? There's ways that people identify and affiliate as. And, yes, women have pelvic floors and have a lot of pelvic floor problems, but men do too. People who are intersex or non-binary do as well as our pediatric patients, which they get left out a lot. Infants have pelvic floor problems, toddlers, preschoolers, elementary age, teens and tweens. I know I have a 13-year-old and we're going through some period pain, irregularity stuff. And I'm like, that's a pelvic floor problem. So, it's really, once you dive down the rabbit hole of pelvic floor, you realize that I could go pretty much anywhere and talk to anyone and say what I do. And in 5 minutes of a conversation, we'll be talking about a pelvic floor problem they have.
I believe it. And the fact that you're saying that you're such a broad spectrum of people, I would have never thought of that at all.
Yeah,
it's really.
Yeah, we really think of like the moms who leak when they cough, laugh, or sneeze. That's what you think of with pelvic floor, and then you think, oh, you do Kegels and you'll be all better. But it's a little bit more in depth than that.
Mm-hmm. So this just kind of reminds me of like just everything. Our goal right now is to make the whole perimenopause, menopause conversation just everyday conversation, no shame, no embarrassment. And I think the same thing with pelvic floor. Like this needs to be discussed a lot more without the shame and embarrassment that you see with it.
Because I remember the
I
same thing. I was so embarrassed, and it was great because the physical therapist was like, "I talk about it every day." Just like you
Yep,
said, I talk about
yep,
pelvic floor within
yep,
5 minutes with everyone, and I can assess that it's a
yep.
pelvic floor issue.
I'm like, "Tell me all your butthole things. Tell me all your vagina things. It's totally
Exactly.
fine. This is a safe place. It's like looking at an elbow for me. Totally cool. No problems here." I know I always love people are like, "I think this might be TMI." I'm like, "Did you look at my wall of pelvic floor organs that I have over here?" I literally have a wall of pelvic floor organ stuffies. I'm like, "It's really safe space, promise."
I love it. I
Oh,
love it.
then you're
Yeah.
on the right podcast because this is
Yes,
all safe space.
this is the right
Yeah, this is
podcast for
awesome.
you. So, why is it important for women's pelvic health to come see you, like post pregnancy or perimenopause or menopause?
So I'm going to start with because you guys, I was researching you and I know you're perimenopause, menopause. So when I get patients in that age group, I'm like, this has been building for you since you were a teenager. And so a lot of times people will be like, I was moving my kid into college and all of a sudden I have this bulge in my vagina that I never had before that I noticed in the shower. And I'm like, yeah. So let's back up and let's hear your history. And then they'll be like, I had painful periods and then I had kids at 20 and 24 and I had an episiotomy with both deliveries. And then, I had some leakage after I had my babies, but then it kind of went away. And then, I was really busy. I had a really active job and then I got promoted. So now I have a desk job. So I've gained like 20 pounds. And, my husband has a little ED. So we're not really sexually active anymore. And then all of a sudden, fast forward to I was moving my kid into college and my vagina fell apart. And so it's been building. And so I, a lot of times, am the person who goes back in their history with them and says, okay, so we have a history of having some pelvic floor dysfunction with painful periods. And then we had these childbirths that were maybe a little bit traumatic to your pelvic floor that were never rehabbed. And then we had some pelvic floor symptoms that resolved on their own, or we just accepted them as normal. And then, we weren't as active as maybe we were before. And then we weren't as sexually active as we were before. And then we went through menopause or perimenopause. So we had to drop in estrogen, which doesn't help things. And then we lifted something heavy and all of a sudden now we're having symptoms. But this has been building for a much longer time than just the 5 minutes that you picked up a crate to move your kid into college. And so I think that's where we have to look back and say, what could we do for our teenagers? What could we do for our pregnant or postpartum patients that prevents them from having this problem in their 50s, 60s, 70s, 80s? And so I really think that anybody who's pregnant should be doing pelvic floor rehab. I think anybody postpartum should do pelvic floor rehab. I think anybody who has any symptoms anytime in their lifespan should be seeing a provider. It doesn't have to be a long plan of care, but just checking in with somebody and getting some information. And it's really about prevention because we can prevent so many things. I always laugh because, as a business owner, you do your numbers, right? And you look at your retention of patients. And my postpartum patients are like, they have maybe 2 or 3 follow-ups. They don't retain well. So when I first started my business, I was like, what are we doing wrong? I started reaching out to my patients like, why aren't you guys coming back? They're like, we were with you our pregnancy and we needed like 2 postpartum visits for a checkup and like, we're better, we're fine. And I was like, oh, we're just doing our job too well. But when you do that preventative care, you don't need as much postpartum. You don't need as much moving forward. I've been a therapist now for almost 17 years. And I've been a pelvic floor therapist for about half of that. So I get to see how people do so much better in results in, pregnancy, postpartum, menopause journeys when they've had pelvic floor therapy all along.
That's amazing. So
Mhm.
we wouldn't be here discussing our pelvic floor all the time if we had the treatment from you back when we were pregnant.
A
In
lot of times that's yes. I mean, some patients, Jane Fonda actually, like her program is really great for the pelvic floor. So I have some, 80s and 90s moms who did that
I
program and they
bet.
haven't needed me as much because they're like, I didn't leak when I coughed, laughed, or sneezed, or I didn't have XYZ problems. And I'm like, because you did hip and core strengthening with Jane. So there are some people who have done some things that because it's not like we're coming up with something new and crazy, but you needed that specific abdominal canister rehab to help you get past your pregnancy or postpartum period.
Interesting.
No, it's true because I think I was telling you, like, when I knew how it was connected to breath and
Mhm.
with working out and the diaphragmatic
Been doing it.
breathing, I was like, "I would have been doing this. I would have been doing this the whole time," but no one ever told me. So
Right.
I think there's different groups of people too, and I think you asked this as a question later on our list when we looked at the pre-record. But, there are some people who need strength help, and there are some people who I call them affectionately the tiny vagina club. And I was actually one of those people
I think
where
that's
like I couldn't get any tampons in my body. When I tried to have sex, I was like, how are people having sex? Like, why do people like doing this? This hurts so much. Like, what the heck? Like, how do people do this long enough to get pregnant? Like, ew. And then and then you can't get poop out. You have to pee all the time. Like, those are like the tiny vagina club people where everything is so tense and tight in their pelvic floor. that you can't get anything in or out. And then there's other people who don't really have those problems. And that was my roommates in college who were like, sex is so great. Don't you hear us having so much fun? And I'm like, yeah, that's not the sex I'm experiencing right now at all. And that was actually my introduction into pelvic health, because I had to teach myself I was 20 years old in a, committed long-term relationship and could not tolerate sex without crying. And I was like, someone's got to be able to help me. And no medical providers can answer questions like, oh, drink a little alcohol. Oh, you're probably just anxious. Did you try lube? Did you try a different position? I'm like, of course I did all of those things. And this is still awful. And they're like, oh, you probably just don't like men then. I'm like, I'm pretty sure I do.
Wow.
And so I had to do my own research. I'm like reading the DSM in the Library of Stockton. I'm reading like Cosmos. And because back in the day, in 2004, 2005, 2006, you couldn't just Google my vagina hurts when I put stuff in it, or why can't I have sex, or why do tampons feel like triangles? Now I think there's a lot more awareness about that, but that's kind of, those are the divide of patients I see, is people who have kind of like things are falling out, there's weakness problems, there's leakage, or people who are like, nothing can come in or out. I have all this pain. I don't know why. So there's a wide variety of what you see.
This is so
It
interesting,
is.
really.
I know. And then so with that, I guess, or could it be different? What changes does the pelvic floor go through during perimenopause and menopause with a change in hormones, drop in estrogen?
Yeah. So basically, after you turn 30, there's a drop in estrogen and there's a change in hormones.
So
So we always think, oh, like perimenopause, like 40, 45, 50. No, it starts when you're in your 30s. And there's also certain time periods in a person's life where they will be kind of perimenopausal, even though they're not. So let's say young women have painful periods and they put them on birth control. Right? They put them into a perimenopausal state. They stop their period so they don't have pain. So those patients have a drop in estrogen. So they have perimenopausal vulvas. They have pain with sex. They have dryness. They have more frequent UTIs. They have urinary urgency frequency because their doctor at 16, 17, 18, 19, 20 has put them into perimenopause. Likewise, for nursing or lactating mothers who are taking milk from the body does that by lowering estrogen. So that's your postpartum patients who have pain with sex, a lot of times because they don't have estrogen, or they have lower levels of estrogen than their bodies are used to having. So they have discomfort. And then when we talk about, going through perimenopause, it can be 5 years for some people. It can be 20 years for some people, right? And there's that decrease in estrogen. So estrogen helps us to build collagen. It helps us to get extra blood flow and circulation. It helps to bulk up muscles. It helps to bulk up mucous membranes. So the vulva, vagina, urethra, bladder, those are all kind of mucosal membranes. And so think about like the inside of your mouth as a mucosal membrane. If your mouth was always dry, you'd have pain, you'd have discomfort when you ate certain foods. It's the same thing in your vagina and your vulva and your bladder when you have less estrogen. So it's so amazing that recently they took the black box label off of hormone replacement therapy, right? And so now like people are having access to this, even if they've had cancer, even if they have a family history of cancer, that this is so great because people are going to be able to have those hormones come in and help fix those things. But that's why people have menopausal symptoms of like urinary urgency, leakage, getting up to go to the bathroom at night, painful intercourse, just dryness or pain or discomfort with exercise. Those are all just because of that drop in estrogen and those other reproductive hormones that happen during perimenopausal times.
I love that you just mentioned all that. I really do.
Yes.
Yeah. So are there any like signs or symptoms or dysfunction that women may not associate with pelvic floor health that maybe they should?
Okay, so I think first I want to say that society accepts a lot of pelvic floor dysfunction as regular, right? So it's totally fine to leak your pants, cross your legs when you sneeze. Go, Katherine Heigl says it's totally fine to buy poise pads. Go ahead. Katherine Heigl's a doctor on the TV. She knows what's up, right? Like, I was so mad when I saw that commercial. I was like, what the actual, like,
You can
she's not
say
even-
it.
What the, Catherine, no, like you're not a doctor.
Right.
You're not a doctor. And you also she's never birthed children either. So I'm like, you probably don't even leak, Catherine. How dare you? Anyway, so there's just this society, like women should pee in their pants. It's okay to leak. There's also like, certain gym cultures like CrossFitters. I feel like, you're not exercising hard enough unless you have to mop urine off the floor. And I'm like, again, no, like that's dysfunctional, right?
I'm glad we're
And
not like
Thank
that.
goodness we don't
Oh,
do that.
guys,
We
not
do not
like
do
that.
that at all.
I know.
Yeah.
And I only present at places that aren't like that. Because when I present at places that are like, you should totally work so hard you pee in your pants, I'm like, yeah, we don't.
No.
there's a lot of accepting of that. There's also a lot of accepting of painful intercourse, that like women shouldn't enjoy sex as much as their, their partners, especially if they're in a heterosexual relationship. Like, oh, guys always want to have sex. Guys, have such high sex drives and women don't want to. I think that's like something that is, a misconception too. And we can talk about my thoughts on sex. That's like a
Right?
whole rabbit hole.
We got one of those, don't worry.
And yeah, so I think that we accept a lot of things that are dysfunction as normal. A lot of times people don't realize that bowel dysfunction plays such a huge role in your pelvic floor function. So there's this lady called the vagina whisperer. And I always say when I got into pelvic floor therapy, I was like, I want to be the vagina whisperer. And my colleagues all call me the poop queen, because you can't fix pelvic floor problems unless you fix poop. And so that's, if you think about, you have this canister, and if this canister is all full of poop that's pushing on your pelvic floor, shit's going to get real, right? You're going to have leakage, you're going to have pressure, you're going to have discomfort, and you got to fix the poop before anything else is going to cooperate well.
I quote you on, for the fiber. I think you said we had to have a minimum of either 30 or 34 grams of fiber
The
a day.
35 to 40 is actually the
Okay.
norm. And I was actually reading this morning that I think only 5% of Americans reach that norm, which is insane. Yeah.
I believe it. It's hard. It really is kind of hard to find a lot of foods with that high enough fiber that you eat multiple times a day. But I mean, it
So
shouldn't be. Just eat more
people
vegetables.
people say that. So it's not even that. People say that, but it's funny because I was reading this thing this morning on Instagram, and it was saying, I wish that the person who did the marketing for protein did the marketing for fiber, right? Because we get all our protein in. We don't have protein trouble getting there's protein fiber, there's protein this, there's protein that. It's more about awareness of what you're eating. And so I always tell people, when you go to the grocery store and you pick up something and you read the label on it, like, you just read how much fiber's in something. And if there's not more than 3 grams of fiber in a carby food, it's a garbage food. You don't need to eat that food. So like, this is actually a can of nuts, which you think jumbo cashews should have fiber. 1 gram of fiber.
Really? Did you just
Yeah.
buy that? You just picked it up?
No,
You didn't
this
have
is
to buy
actually
it
sitting
now?
on this is sitting on the Ritz-Carlton in the little tray of like their foods. But
Perfect.
this is like, I just literally like when I go grocery shopping. So like, the better choice here, honey roasted peanuts, which again, you'd think cashews healthier than peanuts, right? But the peanuts have 2 grams of fiber per serving. So this would actually be your better choice if you had to choose something at the grocery store.
Okay.
Like, that's my dad and mom were having my dad has Parkinson's, so he was having some GI issues and he was having trouble pooping. And so I said, I'm not usually your therapist, but like, can I help you out here? And he was like, we eat really healthy. And my mom's like Martha Stewart. I'm like, you guys do eat really healthy. Like, they make everything really healthy. They go to farmers markets there. I had him do a fiber log. He was eating 11 grams of fiber a day.
Wow.
Wow.
And so all we did was we switched the kind of oatmeal they bought. We switched the kind of bread that they bought. They were eating a whole wheat bread that had less than 1 gram of fiber in it. And then we switched like their salad at the end of the day to like a chopped salad versus like an iceberg lettuce salad. And then he was getting 35. So sometimes it's just these little simple swaps that you have to do. I'm like, you can eat the same food. It's just the one that you picked from the store, like the way that they produce things are just sometimes different.
Right. I'm always pushing the Mission Wraps because they have 17 grams of
Mhm.
fiber in them. So
Yep.
I have 2
And
of them for
those are
dinner.
great for most people. Sometimes it's actually too much fiber for people, but that's a whole other
That's a
whole other
different
issue.
podcast.
That's a different day. That's a different day.
That's right. That's
Yeah.
right. Okay.
So,
Yeah.
can you walk us through an evaluation for physical therapy externally and internally of what a patient
Sure.
would experience?
Yeah. So you call my admin, or first you call an office's admin, and you do your intake paperwork. Our practice is a little unique. Most pelvic floor practices don't accept insurance. We do, because we really value accessibility to care. So you do your intake paperwork, and then I usually send you some general health stuff. Like, do you have any heart issues, any lung issues, any surgeries, like, general health stuff you'd fill out for any provider. And then you come in and you fill out a questionnaire that's about your bladder, bowel, and sexual function, whatever you feel comfortable sharing. So it asks questions about leakage. It asks questions about how often you go to the bathroom for peeing and for pooping. It asks questions about how comfortable sex is, what parts of sex are comfortable or not comfortable. So we just kind of get a baseline of information and some talking points. And then I have my patient come in, I review that information with them. I ask them clarifying questions. I'm one of those people that always has questions. So I'm like, what about this? What have you tried? Who have you seen? What's worked? What hasn't worked? Because I always joke I'm like the quarterback, where I'm trying to like take all the information and fix what I can, and then like send patients to where else they need to go. So if they come in and they're like, well, I've seen my primary care doctor and I've seen, a urologist. And I'm like, yeah, urologists are kind of garbage for pelvic floor dysfunction. Maybe urogyne might be a better choice. To see a GI provider, or or maybe we actually need to go and see like neurology, so there's trying to figure out where people need to go in their journey if I'm not the only person to help them, because I'm usually just part of a care team. I'm not the only one who can fix all their problems most of the time, especially if they're complex. So then I usually go over, I have a book called Pelvic Health 101 that I wrote and published on Amazon. And it basically just goes through the whole anatomy of the pelvic floor. So here's what your organs look like from the side. Here's your abdominal canister. Here's what poop should look like. Here's what the pelvic floor muscles look like. Here's what the vulva or the perineum looks like. Here's where all your parts are. I once had a patient who was 82, one of my first pelvic floor patients back in the day, and she came in and kept telling me, my clitoris hurts, my clitoris hurts, my clitoris hurts. That was her primary complaint. So I say, okay, your clitoris hurts, cool. And we're doing her pelvic exam and I'm mapping stuff out for her and her perineum. And I get to her anus and she's like, that's my pain, my clitoris. And I was like, who taught you this is your clitoris? That's a bad husband. I've never not educated someone on where their body parts are, because you just never know what people assume is a body part, right? And so this
My
poor little
goodness.
person, her husband's like, yeah, I'm touching her clitoris, right? He's touching her butthole. So you can bleep me
That's
out wherever you
me.
need to.
Oh, no. This is a highlight.
Wow.
So yeah, so I always make sure I educate people on where their anatomy is before I even get them undressed or ever touch them or look at them, because part of pelvic floor providers should be really trauma informed, and trauma informed means that we acknowledge that people have trauma going into every life experience, and we're trying to minimize the trauma that we as providers or in office cause to that person. And I think a lot of providers could do better in that area. But we are always being really careful to acknowledge that people have been through stuff. And I mean, so many people have sexual trauma or, psychological abuse in their past that just kind of presents when they come into pelvic floor therapy. Just all the tears turn on and they just all of a sudden remember this happened. So we're just kind of working through that with them to help hold their hand through all of it. So we
Wow.
go over their history, we go over pelvic floor 101, and then kind of explain it in reference to what symptoms they have. So if someone comes in and has urinary urgency frequency and they're pooping all night or peeing all night, I might be looking at how their bowel history is and how their poop is affecting those things. Or if someone comes in with pain with sex, I might be asking how are tampons, how are speculum exams, how was this, and this in your past, and putting a piece together there. Or if they have leakage, I'm like, okay, is it leakage with this or is it leakage with that? So we're just trying to piece together all the things they're telling me. And then we can do external assessments or internal assessments. So before anybody takes their clothes off, I'm looking at how their back is moving, how their belly is, how their hips are moving, what their external pelvic bone alignment looks like. And then sometimes that's the first visit because, we have 45 minutes to an hour. So sometimes that takes up that whole time. And I don't like people to leave my office without something actionable. So they might go home with a bladder diary. They might go home with a fiber journal. They might go home with just some information to read. They might have homework just to work on some breathing or some pelvic floor connection exercises. And then if we do a pelvic assessment, I'm always that's optional for the patient. We have other options in our clinic. I have a real-time ultrasound machine that you can look at. You can put a probe on the belly and you can see what the bladder is doing, and the bladder's here and then the pelvic floor is kind of under the bladder. So if the bladder lifts, the pelvic floor is the one lifting it. So you can do that. That's a very trauma informed, non-invasive way to look at the pelvic floor. I use that with my pediatric and male patients a lot if they're not, interested in showing me their perineums. And then we're looking, if we get to the point of looking at pelvic floor, first I look with just my eyes, then I ask permission to feel with my hands and feel what's happening. We're kind of looking at all the parts. How's the skin looking? How's the coordination looking? So your pelvic floor should be able to do three things. Pelvic floor at rest is just kind of holding all your internal organs and holding your farts and your pee and your poo in. And then if you have a cough, laugh, or sneeze come along, your pelvic floor goes, oh, we got to hold that up. Boop, boop, we got to hold it in. And then if it's time to let those things out, it kind of has to lengthen and let things come out. So we want to make sure the pelvic floor can do those three motions. We can feel on the outside if anything is painful or tender. And then I always swap my gloves out and ask permission, and we can do one little finger inside the vaginal or rectal canal and check that way too. Time that you've gotten to that point with my patients, they're usually go ahead and do whatever you want, right? Most of them are we're here for it. Let's do it. I have some patients who are maybe not today or ever. I'll let you know. But again, it's about that comfort level. And I think a good pelvic floor therapist is never forcing someone to do something they're not comfortable with.
It's
And
interesting.
I always tell people looking at a perineum is like looking at an elbow for me at this point in my life. I see probably 7 to 10 of them a day. And I haven't done the math, but I probably have seen close to 1,000 over the past 10 years. And so Not a big deal to look at a perineum. And then people are always afraid, like, what if I pee or poop or fart on you? I'm like, we'll still be friends. It's fine. Like, don't worry about it. Don't make me clean the bottom of my dishwasher, but looking at your perineum, totally fine.
Wow, or you're really great. Like, I would want to come to your place because you just make it seem
100%.
like it's just, it's just part of our body, and it should be that. That's the whole point. Is it? We should be not be embarrassed. We should be able to take care of our health, and this is an important part of our health without being embarrassed. And you are taking that out of there. So thank you. I think that's really awesome.
Mhm.
I'm so
Right.
blessed to have a really awesome team. So all of my team members are like that. Everyone always comes in, they go, this feels like a spa, not a physical therapy place. Everything in our clinic is private, one-on-one. You're not in a big gym talking about your sex life with other people and your shot. That's important. And those are things that you want to find in any public. I can't see all the pelvic floor people that everyone needs. There's so many out there, right? So like when you're looking for a practice, you just want to make sure you find someone that feels safe and comfortable for you like that. And that's where your education comes in. Like ask what they've done as far as education and learning and training, because that's where you find like the good versus the bad pelvic floor therapists.
Right. Yes. I mean, obviously, someone can say they're a pelvic floor therapist, but they may not have done the hours, the 2,000 hours that you did.
So I have my certification. I think I'm actually the only one in my practice that actually has a PRPC. My girls have probably the same level of hours of treatment at this point, but they just haven't sat for the test. But you could take one pelvic floor class or one online class and say you're a pelvic floor provider. So it's just very interesting to see. And I've had patients, I get a lot of the ones who fail out of other places locally, and they're like, oh, this was not what my experience was like there. And I'm like, yeah, how do I politely say this is different?
Right.
Yeah.
And
Yes.
I guess because it's still such a taboo topic for people that, the practitioners aren't caught up yet. And maybe more and more will catch up to where you are. So
Yeah.
hopefully. Can you give like our listeners just two things that they could start at home right now to make their pelvic floor stronger?
Yes. So breathing, we have a pelvic floor joke whenever I teach a pelvic floor education class or a workshop. I always joke, when in doubt, just breathe, right? So breathing, our pelvic floor would be here and our diaphragm is here. They work in opposition of each other. So if I have to take a deep breath in, my diaphragm has to lengthen. So my pelvic floor would kind of lengthen and relax. And then when I exhale, my diaphragm has to kind of tuck back up and in to let my like lungs kind of fill up or like let the air out. And then my pelvic floor kind of so whenever you do breathing, you're kind of gently working your pelvic floor and just working on that movement there. So sometimes just deep breathing for whoever walks through your door, whether they leak, whether they have pain, whether they have urgency or frequency or constipation. I don't think breathing's ever a bad exercise for someone to do. And like doing that really nice deep diaphragmatic breathing or kind of breathing, we call it rib cage breathing. So if you think about your rib cage, breathing into your rib cage, kind of letting your rib cage, my camera is like super close. There we go. So breathing into your rib cage and then kind of exhaling out. Like that's a great, yeah. So that's a great, that's a great exercise for people. You can't go wrong with that one. And then the other thing I had reviewed before, so I had a list, just overall awareness, right? So a lot of times I'll give people that pelvic symptom questionnaire. And one of the questions is, how often do you go to the bathroom during the day? And they're like, I have no idea. And I'm like, how do you not know? Right. Then they just don't know because they're not paying attention. They're just like, I just go to the bathroom when I feel like it. And I'm like, okay, cool. Like, can you count that for me? And can you log that for me a little bit? Or could you give me like, do you think it's every 20 minutes? Do you think it's every hour? Do you think it's every 6 hours? And some people just really have
I
no
do.
concept,
No,
right? They have no concept, right? And I guess I'm a pelvic floor therapist. I've been one for so long. I had pelvic floor issues before that. I'm like, I know exactly how often I go to the bathroom, right? So that like awareness of things like that, or awareness of how often they have a bowel movement. So I'll say like, do you have regular bowel movements? I don't know. I poop when I poop. I'm like, okay, great. Like every day? Well, I don't know. And I'm like, what does your poop look like? Like, what's the texture? Well, I don't look at it. I just wipe and flush it. I don't look at it. Ew. So just awareness of like what's going on with your body. Sometimes I'll ask like, do you think that like what you eat is what comes out in your poop? And they're like, what do you mean? I'm like, does what come in is what comes in, what goes out? And they're like, I don't know. So just even things like that, because you could poop every day and still be constipated because there could be a little tiny bit of poop coming out of you every day, but you still have all that stool sitting in sitting in your intestines that's not all moving out. Or, you could be peeing and you could have, let's say you have stress incontinence and you're, having leakage when you have a strong urge. Sometimes that's because someone's a teacher, and so they go to school and they're working all day and they hold their bladder for 8 hours, and they don't want to, they're rushing home to get kids. So they hold their bladder for 8 hours. They've been drinking coffee all day, and then they get to their driveway and all of a sudden they're peeing in their pants in their car. And I'm like, is this an actual pelvic floor problem, or is this like a user error problem, which I call that, right? Because if we use our organs in a way that they don't like to be used, they're not going to work very well. And so that's awareness comes so in handy for some patients. So I have some patients that come and see me 1-2 visits and they're like, Maura, all my stuff is better. And I'm like, yeah, because we just pointed out a few little tiny nitpicky, things. We tweaked a little bit of stuff, and that's all your body needed, because our bodies want to have homeostasis. They don't want to leak. They don't want to have pain. We just have to find like how to ideally, we're like a house plant, right? We need water, we need light, we need fiber. So we just got to figure out like what our bodies need, and then they kind of work on their own.
That's really good. That's
That
interesting.
that
So
is very
those are
interesting.
when I read that question, I think those were my two where I'm like, you can't really go
Okay.
wrong with either one of these guys.
No, it's a good start.
It
It's
is.
a good start.
Mhm.
Yeah.
And you touched on it. We started to talk about it, but how does pelvic health affect your sexual health?
Okay, so this is always so interesting to me because I teach a lot for pelvic floor providers, and sometimes they're like, we shouldn't be talking to people about sex. And I'm like, the pelvic floor does sex, bowel, and bladder function. So why the heck would we not talk about sex? Like, it is an activity of daily living if you want it to be. You should be able to, whoever wants to have sex and wants to have orgasms should be able to do those things. And so it's a huge part of it. So if you think about, we talked about the pelvic floor does 3 things, right? So if my pelvic floor is always stuck here, when I try and go ahead and put something inside of my pelvic floor, it's not going to feel very good, right? If my pelvic floor is always stuck down here and it's kind of always floppy and loose, that's maybe not going to feel so satisfying or good as well. Orgasm satisfaction and pelvic floor strength go hand in hand. So the weaker the pelvic floor, the less powerful or strong an orgasm is. And likewise, if a pelvic floor is super tight, those patients have a really hard time having an orgasm as well. So there's just this huge variety. And then I always hear people come in, one of their big complaints is like, I don't have a sex drive, or I don't like sex, or my sex drive mismatches with my partner's. And there's a really great book called Come As You Are by Emily Nagoski that goes into this a lot. And there's another book called Sex Talks by Vanessa Mayer, and that's a really good one too. And they just talk about like, we don't want to have sex we want to have sex that's worth having. So if I have sex and it's like meh or it's uncomfortable, like, why am I going to choose to do that versus sitting in my jammies and watching Law and Order? Like, what's going to motivate me to want to do this, right? And so we want to have sex that's worth having. And so if you're having sexual activity and you're not having an orgasm and you're having pain or discomfort, or you aren't enjoying it, or you're not connecting with a partner, it's not that you don't have a sex drive. You just don't want to do that thing that's not really great. So that's like one piece of sex. And then another piece is like if you're, perimenopausal, right? So if we have dryness or pain or discomfort, or some of my patients get UTIs every time that they're sexually active. Again, I'm not very motivated to do that thing. If it's not going to feel good and I'm not going to have an orgasm from it and I'm going to end up with an infection after it, like, I'm just not going to do that anymore, right? And so we want to see, like, can we problem solve that it feels better, that we don't get a UTI afterwards, that it feels comfortable while we're doing it, that we actually, get the outcome from the activity that we want, then I'm going to want to do that a whole lot more, right?
Right. I mean, that just sounds like, it sounds like one, yes, the pelvic health, but also, a commercial for HRT,
Yeah.
Mhm.
and
Yeah.
Yeah.
And I think
very good.
too, like, there's just, and I don't know how much you want to talk about sex, but there's just so much miscommunication and like misconceptions about the sex that's presented to us. So if you think about, like, did you watch Bridgerton, or did you read Twilight or 50 Shades of Grey? Like, the sex that we're given in media is just so incorrect. And I see women who are, in their 50s or 60s that have this misconception. I see like teenagers, young adults that are just like, I'm broken. And I'm like, why? Well, because I can't have sex. I can't have an orgasm with intercourse. I'm like, neither can I, girlfriend. Neither can 75% of women.
Was it like 10% of women? Yeah.
I'm like, the Vanessa Marin has a podcast as well, and she's a sex therapist, and she talks about, like, if you want to have an orgasm from intercourse, someone or something must always be touching the clitoris.
Mhm.
And like, that's like a really big concept for some of my patients. But like, I'm not broken, and this is the solution to this problem. And I'm like, yeah, it's pretty simple, right? And they're like, yes, right. And then the sex that they're having is worth it and fun and enjoyable, and then they want to have more of it. But if you just go into an experience being like, I'm broken, something's wrong with me, this isn't really going to be fun anyway, then we're not going to have any desire to want to do that activity. It's like, eating something that doesn't taste good, or I don't know. For me, I always joke, I'm like, I have a pretty good sex drive, but I have no exercise drive. Like, I'm like, I don't want to go exercise. No, thank you, please. Right?
I'll
Like,
just have sex instead.
I'm going to be sore after I do this, and I have to like put shoes on for this and a sports bra. Like, and so I get my patients who don't have a sex drive, because I'm like, I am the same with exercise drive. For some
That's
reason
funny.
with sex, I'm like, I can pep myself up and I know I'm going to like this afterwards.
Sure.
And so I'm
Just
going to do
take
it.
your clothes off.
That's because you
right?
don't need
That's
to
how they
wear a
use it.
sports bra.
Well, that's the whole,
The
there's
sports
three
bra,
different,
right, yeah.
there's three different types of desire. And so that's, everyone thinks that they have to be this spontaneous, like, poof, I just want to have sex. And I'm like, most people are actually responsive desire, which is my partner comes up and like, comes and gives me a hug and kisses my neck and like snuggles me. And then I'm like, oh yeah, I remember you. I could do this, right? Like that's, most of us are more responsive, especially as we get older and we're not in the honeymoon stage and we don't have as much of that, like, those new relationship hormones like oxytocin making us like want to,
Right.
constantly meet with that person to keep them for life. Like that's normal. That goes away in long-term relationships for most people. And then also some people are context specific. So some people are like, it has to be like, 12 o'clock noon. I have to have showered and shaved. I'm wearing my red underwear. The kids are not home. The dog is here. Like they need like this perfect scenario to feel sexual. And none of those things are wrong. But that's where like sometimes people are like, well, if I'm not spontaneous desire, then I have a sex problem. And I'm like, no, you're just in that phase or season of life that doesn't, have that poof, I want to do it. And we've been there.
So just off the cuff question. So do orgasms help your pelvic health? Your pelvic
Yes,
floor?
yes. So actually it's funny, when I have patients who can't figure out how to do a Kegel and I want them to do a pelvic floor contraction or a Kegel, I'll ask like, are you able to have an orgasm? And like, I'll, try and respectfully ask about their sex life. Like, do you have orgasms when you're by yourself or with a partner? And if they do, I'm like, so then your homework's to go have some orgasms. So husbands usually love my homework because it's usually like, get back in the bedroom and do a good job. But yeah, and I also
Keep
am,
trying.
like, but I also consider like, masturbation or self-love is also, to me, sex. Like that's, it doesn't have to be partnered sex. It can be your own activity by yourself. And that's perfectly
And it's good for your
acceptable,
pelvic
too.
floor.
It's good for your pelvic floor. So orgasms help to contract and relax your pelvic floor. So it's a pelvic floor exercise. They bring endorphins for people who have pain to that area. They bring circulation to that area. So it's really, you can't go wrong with an orgasm unless it's hurting you after you do it.
Okay.
So, Maura, that should have been the third thing that you recommend for people to
Orgasms,
do
all
at
the
home.
orgasms.
Right.
You add that to the list of
That's right,
breathing
yes.
and awareness.
We are very sex positive in our clinic. It's funny
Okay.
because
No,
I
it's
have
good.
patients who have like pelvic organ prolapse and they'll be like, well, I have this problem with my vagina, so I probably shouldn't have sex anymore. And I'm like, actually, for prolapse, like, orgasms and sex are probably the best thing you could do. Like they're going to
Right.
push the prolapse back where it belongs, and then they're going to contract the pelvic floor to keep it there and then bring some blood flow to smush things up and hold them. That's like the best homework you could pick for yourself.
That's pretty good.
Yeah.
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 So, all right, we're going to go, and you did touch on this a little bit too, but we're going to go back and it's kind of like the exact opposite. How are our bowel habits connected to our pelvic health?
So they're very connected. So if you are having trouble getting things out of your body or things are leaking out when you don't want them to, that's a problem of pelvic floor dysfunction, right? So if my anal opening, let's see if I can get my fingers, there we go. If my anal opening is always too tight, that's going to be hard for poop to come out. And likewise, if it's kind of always a little open, I might have some fecal leakage or smearing. Right? So that could be debilitating in either way. I have some patients who leak stool and they never want to leave their house because they're worried about the odor or not being near a toilet. That's really hard for people. And then I also have patients who can't poop and their whole day revolves around pooping and they can't leave their house until they poop, or, they don't feel comfortable pooping in public. Like, so there's all that. And then other problems that people are not always aware of that are bowel related is urinary urgency frequency, like urge incontinence. A lot of times, or like just overactive bladder is a lot of times constipation. Getting up to pee at night, like nocturia, like my male patients who are like, I get up all night, I pee all night, I have BPH, that's probably what's causing it. They're usually constipated. Or female patients, same thing. Little kids who wet the bed, constipation. Frequent UTIs. Whenever someone has a history of frequent UTIs, almost always constipation is related to it as well. So those are a lot of diagnoses that get referred to me for the clinic, and they're almost all bowel related.
Wow.
Interesting.
That is
Yeah.
interesting.
So
Yeah.
that's what I said. I wanted to be the vagina whisperer and I'm the poop queen. I can fix a whole lot more problems with fixing someone's poop. And this is where sometimes I only see people for a visit or two because I teach them about fiber. I teach them about proper voiding positions as far as breathing and using a squatty potty while they poop. I teach them about, what stool consistency should look like. And all of a sudden they're like, oh, my other symptoms got better. And I'm like, yeah, because they were all coming from constipation or, bowel issues. Yeah. So
Well, it's just fascinating.
Yeah.
That's
it really
all of it.
It
All of
right.
it. It's fascinating.
it's definitely, and the more you dive down pelvic floor, the more you're like, oh, that's a pelvic floor problem. Oh, that's a pelvic floor problem. It's
In
yeah.
fact, I feel like we need to have like a Mora 2.0,
Yeah.
just like
I
with
could do
Cindy
it.
Dupuy. There's so much more to discuss.
There's a lot to talk about.
It really
So,
is.
other than your practice, Practically Perfect, where else
Mhm.
can our listeners find you?
So we have a Facebook and an Instagram that's Practically Perfect PT, our Practically Perfect Physical Therapy. We're on Facebook and Instagram. I do have a little YouTube channel with like some free exercise videos and stretching videos. We have a happy bladder challenge on there. Our website has links to all of that. It's www.practicallyperfectpt.com, and I have a lot of freebies. There's a fiber freebie, a fiber tracker, happy bladder challenges on there. I try and give people as much as I can because some people can't afford to come see me, or they're working, or they're taking care of 4 kids and they're a stay-at-home mom. So, I get that pelvic floor therapy. Sometimes it's just people are so nervous to come and see me. I have some people who have followed me for 8 years, and then they're like, I finally came in to see you. And I'm like, I feel like I know you. Like, you comment on all of my stuff. Like, hi. For some people, it takes a lot to come in and get in to see us. Yeah, our website is a great link to pretty much everything that we have to offer. We do free baby and me play skills classes every Wednesday for like postpartum parents to kind of come and have like a place to meet other parents. And it's always run by a skilled physical therapist. So they can always ask questions about their peds patient stuff and postpartum questions. So we offer that. We do a free birth class, like a birth prep class every 3 months or so, just to help people prepare for their labor and delivery and postpartum period. We're going to actually start having a fit for baby, fit for mom, Benton or fit for baby is going to come start teaching some prenatal classes in our clinic pretty soon as well. So we try
Great.
and be like a one-stop shop we do a free osteoporosis class, I think usually once a month. We might go to every other month depending on attendance hasn't been great for that, but we try and do that for some of our, perimenopausal, age group
Yeah.
as well. Well, there's not, I mean, again, like, 'cause it's hard. That group is a little bit more diverse in what we can offer, right? Because some of you are having trouble with sex, and some of you are having bladder and bowel issues, and some of you are having bone health issues, and some of you have all of the above, right? So
Right.
it's hard to find a perfect class for that age group because there is
Sure.
just a lot going on.
We have way too much going
Yeah, we
on.
do. We do.
Trust me, every season of life I feel like has stuff, so
Yeah, I
I
know.
get it.
Absolutely.
Yeah.
Definitely.
All right. Is there anything else that you wanted to share with our listeners that maybe we didn't touch on?
I mean, I think we talked about a lot of
I
stuff. I
think we
think
did.
when in doubt, like ask your provider, knowing too that, in New Jersey, we're a direct access state. So you can go see a physical therapist, I think, or occupational therapist without a prescription usually. You're like a doctor, any provider will have to sign off on your plan of care. But, sometimes you'll see your gynecologist and they'll be like, oh, just wait and see. It'll probably get better if you drink some wine before you do it, right? And so you can kind of have the right to say, like, no, I'm just going to go anyway. Right.
Yeah.
And so as long as your insurance allows that, you can do that. So I think that some people let their providers gatekeep more for them than they have to. And so just saying like, no, I want to try this. And so that's something I sometimes practice with my patients saying, you know, your doctor said you can't do this referral. Well, why don't you go back to them and say, I appreciate your input, but I would still like a referral for blah, blah, blah. And just, teaching them how to be advocates for themselves because I think our medical, it depends on your provider, but sometimes I feel like medical providers are just like poo, poo, poo. And I'm sure that they do see so much and they see like, someone comes in, oh, I just have this vulvar dryness. And they're like, well, I see someone whose vagina is falling out. So like your vulvar dryness is nothing to me because I see patients that have this, this, and this. But like just being a provider, sometimes you have to take a step back and be like, this vulvar dryness is really debilitating and affecting this person's life. And we need to do something about it, even though I don't think it's that big of a deal. It's a big deal for them. So just
Absolutely.
advocating. If you feel like you need services or want services, advocate for yourself and find them. And then also, not all pelvic floor therapists are created equally. So if you try one for a visit or two and you're like, this is not a good fit. And I tell people, sometimes I'm not your circus and your monkeys. Like sometimes I'm too much, I'm too bubbly, I'm too this, I'm too that. There's 3 other providers to pick from in our office, or I can always refer you to someone that feels better if we're not it. Because you're not always going to be a perfect fit for everybody. So, if you've tried pelvic floor therapy and you're like, well, I went and all they did was this or that, try a different person, try a different place and see if that's a better fit for you. Because that could be, it could be helpful.
Very good. So I have one other question that
Sure.
I did not present to you before.
That's okay.
Do you find that, and this is more of a personal question for me,
Mhm.
like women after they have a hysterectomy develop pelvic floor problems that they didn't have prior?
So yes, and I am very much a person who, like, when patients come in and say like, "Oh, well, I just have, really heavy periods or fibroids, I'm just going to have a hysterectomy just like kind of for fun." Like my, OBGYN says like, "I'm just going to do this." And I'm always like, "Well, why? Like, are our fibroids cancerous? Are we like bleeding so much that we're anemic? Are we like I'm always curious why we're doing a hysterectomy in the first place, because the uterus actually provides a lot of internal support for our pelvic organs and our SI joint. And so that can be problematic for people afterwards. I'm not anti-hysterectomy. I am just always like, do we need to do it? Do we need to do it now? Are there alternatives we could try before we do it? And then also, is this patient prepared for what's going to feel like after they've had it? So my hysterectomy patients, they tend to have a decrease in vaginal length because the cervix, if you have your cervix removed as part of the hysterectomy, that creates kind of an inch or two of vaginal canal length. And the vagina is only really like 4 inches anyway. The average penis is about 6 inches. So like there's already a mismatch that can. So my patients with hysterectomies tend to have deep penetration pain after they've had surgery. And so I like them to be prepared for that as a possibility. And then there's some tools and tricks for that. So there's certain sexual positions that you can try to make that much more comfortable. There's a tool called an O-nut, which is like it's like a stretchy ring that there's stackable little stretchy rings that you can put around a penis so that the partner can't go in too far to cause that deep thrusting pain. So sometimes that really is helpful. But I think that's the biggest complaint is not really, I guess I wouldn't, it's a pelvic floor problem in that it falls into the pelvic floor arena, but it's actually not pelvic floor tightness or weakness usually. It's just more of that they have that discomfort or they have a lot of SI joint pain or pelvic, like pubic bone pain because their pelvis is just
Side joint.
differently aligned. Yes. Yeah. And so that's because you have a uterosacral ligament that wraps, like if this is my uterus, the ligament wraps from my SI joint around the front of my uterus to the back of my SI joint. So they take that out. So then you don't have that stability there.
I'll be
Wow.
Yeah.
talking to you.
Mhm.
So and again, like I usually just like, I love to see people pre-hysterectomy to kind of prepare you for that. It's like when they go to do a knee replacement. I used to work in back rack and they would do knee replacement. Like, oh, you'll feel great after you have your surgery. And then they wake up and be like, I feel absolutely terrible. Something must be wrong. And I'm like, literally a doctor just went into your knee and sawed off 2 parts of it and hammered pieces into both parts and then connected it back together and then zippered you up with staples. Did you think it was not going to hurt? Like, but they had no preparation for that. The doctor did not tell them. They said, oh, you'll feel so much better after this. And I'm like, in 6 to 8 weeks, when
Yeah.
you've healed and can walk and aren't walking bone on bone anymore. But until then, you're going to have to rehab. So I think a lot of times they don't prepare people for when they do, even like they'll be like, oh, a bladder lift surgery. Oh, that's so easy. It's so low maintenance. And you're like, that can cause other problems for people and that can cause other complications. And so I'm not saying don't do it, but let's look at the pros and the cons and make sure that they are worth it for you as a patient before you go jumping into this. And I think that's where, again, we could be better trauma-informed providers and explain to people all of the things that could happen. But, hysterectomies are sometimes very necessary and needed, but they can cause that pain with intercourse and they can cause that SI pubic pelvic bone alignment stuff to happen.
Very interesting.
That's
Well,
a great,
thank you for
yeah.
answering
That
that.
is a really great
Yep.
point. Mhm.
Appreciate it.
Yeah.
So I don't think we can thank you enough. Like the information you provided in this such a short time
Yes.
was so valuable. And I know the listeners are really going to love it. So
Yes.
thank you so much, Maura. We really
I am
appreciate it.
so happy to
Thank
be here,
you.
and I'm always happy to talk about all the pelvic floor things.
Yeah.
Yeah, and we definitely want to have you back.
Yes. And
We have
we're,
so
You
many,
let me know when.
so many more
right.
things.
So
Yes.
you got one in 2025. We'll get another one in
26.
2026.
You let me know when.
Absolutely.
Yes.
So, well, thank you
Mhm.
to our listeners as well. You can find Chris and I on Not Your Mother's Midlife Crisis on TikTok, on our Instagram, whether you're listening on Spotify or Apple Podcasts, we are on YouTube as well. So until next week, where we continue to seek answers for women's health.
And support one another.
Thanks so much.
Thank you.
Yeah.